Hello, I am Dr. Nismani. In this session, which is a series of video presentation from ACPGMet, I am going to tell you the basics of biostatistics and the research tools used in medical practice. And this section comes under the preventive and social medicine subject during the undergraduate, but this is useful for postgraduates and also for medical teachers who have to submit papers for improving their academic achievement and also to present papers and write research articles. So this is only dealing with the basics, and for advanced knowledge you may have to please consult standard textbooks. Similar concept based telecast are also available in my channel youtube.com/acpgmet, and the links are available in facebook.com/acpgmet. Please visit the site. Entrance test oriented concept bridge and CPCs are available in the same channel. Please visit the channel. So in this series, the essential concepts covered in the biostatistics and research in medical studies are the incidence, prevalence, the case fatality rate, infant mortality rate, neonatal mortality rate, perinatal mortality rate, maternal mortality rate, age specific and proportionate mortality rate, reliability, sensitivity, specificity, positive predictive value, negative predictive value, prospective or cohort study, retrospective or case control study, prevalence or cross-sectional studies, experimental studies and clinical trials, relative risk and odds ratio, the normal distribution or the Gaussian distribution, mean, median, mode and range, the various tests, t-test, f-test and chi-square, correlation coefficient and regression analysis, hypothesis testing. This is actually a series, and so we will start with the first one, epidemiological terminologies. Epidemiology refers to the investigation of factors that determine the frequency and distribution of disease or other health related conditions within a defined human population during a specified period. An epidemic is an increase in the incidence of diseases, conditions or other health related events in a defined human population that is clearly in excess of that which was expected during a specified period. Although the presence of the disease or event is typically occasionally in a particular community, its epidemicity is always relative to its usual frequency in terms of time, place and population. Outbreaks that affect large number of animals are called as epizootic. Endemics are diseases, conditions or health related behaviors that are constantly present in a human population. An endemic may be referred to as the usual prevalence of an event or occurrence in a defined community. Endemics that occasionally or seasonally become epidemic are referred to as endemo-epidemics, and those that are present at a high rate of incidence and affect all ages equally are called hyper-endemics. Pandemics are widespread epidemics that achieve larger geographic proportion. Example, during the influenza pandemic of 19th century, millions of people across the continents were affected. Today, AIDS is considered to be the most alarming pandemic of the century. Primary prevention. Primary prevention is a reduction in the incidence of disease through immunization, sanitation, education or other means of eliminating pathogenic contamination in the human environment. Example, preschool diphtheria, pertussis, tetanus, DPT, immunization of children, polio and influenza vaccination and so on are primary prevention. All the following activities meet the criteria for primary prevention except which of the following? Tetanus vaccination for teenagers, MMR vaccination for first time pregnant mother, fluorification of water, pap smear screening and sex education. The answer is pap smear screening. It's actually a screening technique to diagnose a disease. Secondary prevention. Secondary prevention is the early detection and treatment of disease. Example, pap smear for early detection of cervical cancer and surgical intervention if necessary is actually a secondary prevention, not a primary prevention. Tertiary prevention is the reduction of the complication of the diseases and the improvement in the patient's level of function through palliative treatment and rehabilitation therapy. For example, shortly after the occurrence of hemiplegia secondary to stroke, bed care and physiotherapy are employed to prevent the development of decubitus ulcer and flexion contracture. Similarly, in rheumatic fever, we give penicillin prophylaxis. So here the patient has developed the disease, but we are preventing further attacks and complications. Spectrum of infectious disease. The sequence of events beginning with the exposure of a susceptible individual to a pathogenic agent and ending with the patient's recovery or death is illustrated in the following diagram. Exposure to an infectious agent. The A, B, C, D, E are noted down. A means the incubation period, B is the symptoms, C is the recovery, latency or death, and D is the recurrence of symptoms. And last is death. That is a spectrum of infectious disease. Incubation period from A to B, the time interval between the invasion by an organism and the development of symptoms is referred to as the incubation period. For example, after exposure to the measles virus and before the onset of symptoms, a child is considered to be highly contagious due to continued attendance at school and social encounters with other children. The latent period is C to D. This period is the interval of subclinical infection during which the previously active infectious agent becomes dormant in the host. Example, subsequent to the appearance of genital lesion induced by a herpes simplex type 2 infection, patients often experience period of remission, after which reactivation of the virus elicits the reappearance of the lesion. This interval of remission is referred to as the latent period of the virus. Classification of epidemics. Two fundamental assumptions of epidemiology are that disease neither occurs by chance nor is it distributed randomly in a population. Disease occurs at specific times in specific environmental locations and affects particular populations for very specific reasons. Painstaking explicitness being the key criterion in epidemiologic investigation. When the outbreak of an epidemic is suspected, great care must be exercised both in the accumulation and the description of information regarding etiological agent, host, location, chronology, environmental factors, reservoirs, vectors, mode of transmission, number of cases, and so on. Only after a definitive diagnosis is confirmed and all of the above mentioned factors relating to time, place, and person are described at length can the existence and identification of an epidemic be established and treatment and preventive measures be instituted. Epidemics are classified as follows: common source epidemics, point source epidemic, and propagative or progressive epidemic. Common source epidemic. In common source epidemic, all susceptible individuals are exposed to a specific infectious pathogen or noxious agent like chemicals, pollutants, heat, originating from a usual, conventional, or customary source, that is a common source. The mode of transmission is termed indirect because of the evidence that the pathogen or agent is vehicle-borne, contacted through fomites, food, water, or air, and because secondary host to host, that is direct transmission, is rare. By examining the shape of the epidemic curve, it can be seen that the fewest number of cases become apparent after a minimum incubation period, and that the largest number of peaks at the end of the usual incubation period from the point of exposure to the midline of the curve, creating the typical unimodal shape of the common source epidemic curve. Although the common source epidemics may involve only one incubation period of an organism, repeated or prolonged population exposure to the common source often involves infection by a pathogen over the course of more than one incubation period, producing a wide peak or apex in the common source curve. Example is shown in the figure. Infectious hepatitis or hepatitis A transmitted by food handler at a restaurant, or water contaminated with Vibrio cholera at a local lake or a water source. Here the number of cases is shown in the vertical axis and time is shown in the horizontal axis, and points of exposure and the duration AB and the curve are shown. A is the minimum incubation period, A plus B is the usual incubation period, and the curve shows unimodal distribution in common source epidemic. Point source epidemic. In a point source epidemic, all susceptible individuals are exposed to a specific pathogen at one point in time. Point source epidemic are essentially a subcategory of common source epidemic in which common exposure to the offending pathogen or agent is both brief and simultaneous. As can be seen in the point source epidemic curve, there is a very explosive increase in the number of cases over a short period of time after exposure to the noxious agent. Because the temporal aspect of the curve involves only one incubation period of the offending pathogen, the apex is much sharper and the decline in the number of cases is more rapid than in a typical common source curve. As with common source epidemic as a whole, secondary transmission is rarely seen in point source epidemic. Example, after eating dinner at a wedding reception, many of the guests developed the acute onset of gastroenteritis 3 to 5 hours later as a result of food poisoning. This is an example of point source epidemic. Hope the session was useful to you. The next session will be propagative or progressive epidemic, and it will be dealt with in detail. Please visit youtube.com/acpgmed. Goodbye from ACPGmed and Dr. Nasmani. And similar sessions are seen in the same channel. You can also send your queries and clarification to acpgmed@gmail.com or my personal email drnsmanimd@gmail.com. Thank you.